So here's another mistake that um, people make on the marketplace. When you have an application on the marketplace, now the marketplace, state-based exchange, um, are this it's the same thing. Okay, it's the place where you can go to get qualified health plans. Okay, either you can receive the tax credit or not. I don't recommend going on the marketplace if um, if you don't qualify for a tax credit, because you're going to have to go through a longer process just for a basic plan. If you don't qualify for a tax credit, there's no point in being on the marketplace, I would say, because it's just is taking a lot of your time to fill out all that information, because you're dealing with the Department of Homeland Security, Social Security Administration, and IRS. So I would say if you don't qualify for the tax credit, don't go on the marketplace. Okay. But if you think you may qualify at a later time, then yeah, it's okay. Then that means when you update your income, then you may qualify for the tax credit. All right. So basically, the mistakes that people make on the marketplace is when you have a family or your income is at a bracket that is too low, or kind of, this is what happens. So say you have a family of four or three, you have some children, okay, and your income, you are making income, you have a job, but when you fill out the marketplace application, it says, hey, you may be eligible for Medicaid, or one of your children or two of your children, and it sends them over there. Okay. And some people are like, well, no, I don't want Medicaid. I don't want my children to be on Medicaid. Okay. Here's where the problem comes in. Medicaid, you need to go through the process. And there's a reason you need to go through the process. Okay. So even if they say, okay, your children may be eligible for Medicaid, or you may be, maybe because you're pregnant, go through the process. So when Medicaid sends you a letter or sends you an email, cooperate with them. Okay. There's a reason. Okay. You don't want to have something documented that says, well, the reason they didn't get coverage is because they didn't cooperate or turn in documents. Okay, you don't want that to be said. There's a reason you need to go through the process. Okay, because I've seen so many crazy situations because people did not cooperate. Okay, especially if you have multiple changes, you're having all these changes in your life, and you're going to the marketplace and you're updating, you keep updating your application, and then it says you're eligible for Medicaid and it says you're not, you want to keep an eye out on your marketplace application. I have seen some things happen, okay, that were not really good. They caused the person to have to be on the phone for 2 and 3 and 4 hours for several days to try to get it fixed. And then you got the health insurance tossing it back to the marketplace tossing it back to the health insurance, and then you got the member in the middle that just needs it fixed. Okay, and so I would say, even if you fill out your application and it sends you to Medicaid and you don't want it, just cooperate. If 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 they ask for your income, show proof of your income. Now if they say, okay, well, you still make too much, we thought you were eligible, but you're not, so um just cooperate, because you will have a qualifying life event if they deny you, which will give you a longer time to choose a plan. So even if so basically, so if the marketplace says you're eligible for Medicaid, I'm sorry, a lot of times it won't let you choose a plan unless you pay the full price for it. And I know some people can't afford that, but some people will pay it anyway because they don't want Medicaid. But here's the thing: if you fill out the application with, if I'm sorry, not fill out the application, but if you cooperate with Medicaid, once they send you some communication, when they deny you, then you can go back and update your marketplace application, and you can get the credit. Okay, if you qualify. So don't. And then it also opens up a qualifying life event where you're able to have more time to choose a plan or change it. And some of you don't know that, and it's causing you problems, because I've seen where someone was eligible for the credit and then they lost their job and they got another job some weeks later, and it just messed them up because they got the job, they ignored the letters. A lot of people ignore the letters from Medicaid, and so they don't cooperate. And now, I mean, it's just, I've seen a lot of things happen, and then it'll mess up their 1095A. You got to have that to file your tax return. I've seen where multiple people have been paying for their health insurance to the health insurance company, yet Get Covered New Jersey or Georgia Access or healthcare.gov was showing that they were not enrolled, and yet they were, and they were paying for it. And so the marketplace can only provide a 1095A if they are showing in the system that you had coverage. But what if they weren't showing in the system, but you were paying for coverage and using it? That's a big mess. It causes people to have to be on the phone a long time. You got to keep calling back day after day, staying on the phone for 2 hours. That's a lot of time. So I would just say, anytime that you're dealing with a marketplace, you need an agent. In most of these cases, the person didn't have an agent at all. And so they were trying to be honest and everything, but you still need an agent, a good agent. Now, they don't have to live in your state. I've seen good agents that have multiple states, and they do very well, and they know how to help their clients. But I've seen agents that live in the actual state of the person that they're helping. They don't know what they're doing. All right, so you definitely want to be open-minded about that. And I have, most of my clients are not in my state because I don't know why. I do know why, but I decided, I want to start helping people in my state, and so I started. And states are different. Again, these videos are for education only. Coverage varies by state and by situation. But I'm just saying, you got some states that have their own marketplace. And then if they don't, then you go to healthcare.gov. Okay? So some of the states are like Washington State, California, I think Nevada, Colorado, New Mexico, I think, Maine, Georgia, Virginia. I can't name them all, but some of them have their own state basics change. So I just say, if your application goes to Medicaid, cooperate with Medicaid, and then let them make the decision. Don't have them make a decision and say you didn't cooperate or you didn't turn in documents, because that's not going to open up a qualifying life event for you. Okay. If you have any more questions about that, just in the comments below. Okay.